Hi, this is Chet Kuhn with Medicare Hero, and today I want to briefly talk about a few key points that can help you in your decision-making process as you select between Medicare Advantage and Medicare Supplement plans. This is another one of the most common questions that we get here at Medicare Hero is, how do I make this decision? How do I select which type of coverage is going to be best for me? So first, let's talk about Medicare Supplement plans. The monthly premiums for Medicare Supplement plans range from about $85 to $170 a month. Actually, for people turning 65, I see an average of about $100 to $120 a month for their coverage. It all depends on your age and where you live and things of that nature. So we want to make sure the premiums for a Medicare Supplement plan are affordable. Next, what do we get for those premiums? Well, we can see any doctor or any hospital in the entire country that accepts Medicare. There's absolutely no networks. And when we go to see those doctors, there's no copays, no deductibles, and no out-of-pocket expenses. All we do is pay our monthly premiums, and we're done. Now, prescription drugs are separate, but for any Medicare-covered services, we just pay our monthly premiums, and we don't have to worry about any out-of-pocket health care expenses. Additionally, with a Medicare Supplement plan, you never need a referral to see a specialist. And again, it doesn't matter which insurance company you select. You can always go see a specialist without a referral when you have a Medicare Supplement plan. Now, the last key point I want to talk about is prescription drug coverage. With a Medicare Supplement plan, you can select independently of your Medicare Supplement company a prescription drug plan, and you can select any one that you like. So you can take one company that's going to offer your Medicare Supplement coverage for the lowest price, and independently you can take a prescription drug plan from a completely different company that's going to cover your medications for the lowest cost and copays. So now let's switch gears here and let's talk about Medicare Advantage plans. Medicare Advantage plans were created as a lower cost alternative to original Medicare and Medicare Supplement plans. And when I say lower cost, what I mean is lower monthly premiums. So the premiums for Medicare Advantage plan can be anywhere from no cost in addition to what you're already paying for Part B of Medicare up to $60, $70, they can even go up to $100 a month. The key is with Medicare Advantage plans, we want to keep our premiums low because that is the advantage, is low monthly premiums. So one of the compromises that Medicare Advantage plans make in order to get those low monthly premiums is they have networks. So you want to make sure that your doctors and hospitals that you choose to use are in the network for the insurance company you're looking at. United Healthcare will have a different network than Aetna, than Blue Cross Blue Shield, than the next company. So just be careful and make sure your doctors are in network. Also, your doctors can change mid-year, but we can't necessarily change our coverage mid-year. So with Medicare Advantage plans, they're a little bit better for people who are more actively engaged in their health care, and they're okay putting in some work to save those monthly premiums. Additionally, because we have that low monthly premium, we now have deductibles, copays, and other charges when we use our coverage. So when we see our doctors, if we see a specialist, we might have a small copay. When we go into the hospital, we'll have to pay a certain amount out of pocket. So we get low monthly premiums, but then we have to spend money the more we use our health care. Additionally, with Medicare Advantage, many of the most affordable plans do require referrals to see a specialist. So if that is something of concern, those referrals to be able to see your specialist, you want to make sure and look into that before you enroll in a Medicare Advantage plan. The last point, drug coverage. This is a convenience factor when it comes to Medicare Advantage. Drug coverage can be built in to your Medicare Advantage plan. You don't have to take a Medicare Advantage plan with drug coverage, but if you want drug coverage, your only option is to take your drug coverage from the same Medicare Advantage plan that provides your health care coverage. Now, while it is simple and you just have one health care card that works everywhere, your doctors, your hospitals, and for your prescriptions, it also can be a little bit limiting as well. Sometimes your doctors will accept one Medicare Advantage company, but a different Medicare Advantage company could save you potentially a lot of money on your medications. So that is also something to weigh in. So now that we've hit all the key points of both Medicare Advantage and Medicare Supplement plans, what's the bottom line? Well, Medicare Supplement plans are best for people who the extra premiums for the plans fit into their budget, and if you most value your choice of doctors and hospitals, as well as a predictable healthcare budget where you're not going to have large healthcare expenses throughout the year. You know, if you just pay your monthly premiums, you're going to be set. Medicare Advantage plans, on the other hand, Medicare Advantage plans are simply the best if you're looking for low monthly premiums. I compare Medicare Advantage plans to coupon shopping in a positive way. They can be a good way of saving money if you're okay with a few restrictions or jumping through a few hoops to save that money. Thanks for watching our quick video on Medicare Advantage versus Medicare supplement plans. If you have any questions or if we can be of any assistance, please feel free to reach out to us. You can give us a call or visit us online at MedicareHero.com.